Right. Well, Mr. Chairman, thanks so much for being here. It's great to have you on Newsmax TV.
Thanks for having me. Good to be with you, Kathleen.
Now, the AARP doesn't like your plan. Their recent AARP bulletin headlined an article called "New Medicare Voucher Plan Draws Fire." They didn't say much about the details of your plan,
right.
But they claim that the Congressional Budget Office estimated that by 2030, under the Ryan voucher system, typical 65-year-olds will pay 68% of the cost of their Medicare coverage out of pocket compared with the 25% they pay now. Is that true?
Well, first of all, I think that analysis is deeply flawed. The CBO doesn't do a couple of things. That analysis forgot to mention that the premium support goes up by $700 to $800 more for lower income beneficiaries. It didn't take into account the benefits of choice and competition. The prescription drug benefit works the same way we're proposing our new Medicare system for the under 54 crowd, where you get to choose among competing plans that are competing against each other for your business. That worked to bring prices down by 41% in the prescription drug benefit. CBO ignores those things. Third point is the CBO later in this analysis says the Medicare status quo is not going to happen. There's no way Medicare is going to continue to grow at the pace it is. So that $6,400 number is a number that the CBO very much says is not going to happen anyway. So the status quo is unsustainable. It's a myth. So it's really sort of a fiscal fantasy to compare any plan against some future that everybody says will not exist. Medicare is going bankrupt. What we're trying to do is save the system and give senior citizens choice on how they have their benefits delivered to them in a Medicare system that works a lot like the system I have as a federal employee and a member of Congress. The difference is President Obama doesn't do a thing to really save the system from bankruptcy, but more importantly, Obamacare raids $500 billion from Medicare and puts a panel of 15 unelected, unaccountable bureaucrats in charge of price controlling and rationing Medicare. So government-run and government-rationed Medicare is what the Obama plan is. We get rid of the rationing, we stop the raid, and we give future seniors a choice in how their benefits will be delivered to them.
Is AARP frightening seniors?
Yeah, I think they are. I think they're frightening seniors. And I think AARP is showing their political stripes a little bit more. I think AARP, which helped pass Obamacare, which moves toward a government-run healthcare system, that's more the philosophy that I think they're trying to push through.
Your plan has touched off a storm of controversy. Although he later apologized, former House Speaker Newt Gingrich termed it right-wing social engineering. And White House Green Jobs czar Van Jones actually stated Paul Ryan is more dangerous than Al-Qaeda.
Yeah, I did not hear that before.
Why do you think that your proposals have triggered such a sharp reaction?
I think the left is going to come unglued a little bit because I think people of the left who believe in big government, who believe in growing government so much more, feel like they're on the verge of a big victory in accomplishing that agenda. Here's the problem. The American people don't want that. We are still a center-right country. And so what we have shown with this budget is we can still get America back. We can still have a limited government and economic freedom, a prosperous free market society that's still attainable. We're proving it with our budget using CBO economics, meaning real scorekeeping. We can balance the budget, pay off the debt, have limited government and a free economy. And those who don't like that agenda are going to do everything and say everything they can to prevent it from happening. Now, as far as social engineering, this is as gradual as it gets. It says, if you're 55 and above, no change to your Medicare. If you're 54 and below, by the way, it's not going to be there for you because it's going to go bankrupt. What we say is, have a system that works like the one that members of Congress and federal employees have, which would work like Medicare Advantage, Medicare Part D, or Medicare Supplemental works today, where you have a list of plans to choose from. These plans compete against each other for your business, and you, the future senior citizen, you're in charge of your health care, not some 15 panel of bureaucrats that the president appoints.